Hi, so welcome to this demo on how to use Healthstack to register patients, to attend to patient, document patient encounter, send out prescription requests, and dispense prescriptions to patients. Log in, and this is your landing page for after you've logged on to Healthstack. Here you will find the name of your hospital or facility. This is the main menu button showing the names, the first name and last name of the employee or user account. Button, you will find a list of modules that you can use on Healthstack. One of the modules, we'll be using 3 modules for this demonstration. Client module to manage all patients records, clinic to attend to patients, send out requests, and pharmacy to dispense prescriptions. So I'll click on clients. I'll choose a location to work from. Now on the clients page we have appointments, clients, and payments. For this particular program, we will just be using client only, because all we need to do is register patients. This is the page for patient registration or client registration. On this side you'll find a list of all clients that have been registered at this facility. So this is a long list of patients. Healthstack allows you to register as many patients as possible. This is your create client page form, or called registration form. You can see that there are 4 highlighted or highlighted text boxes on the form: first name, last name, date of birth, which is biodata, and phone number. So what this means is you can only enter these 4 required text fields and save the patient's record. So this is useful for when you have an emergency, or there's a rush, you just want to quickly attend to the patient as soon as possible before you can get that whole detail. So let me I would say that this process for quick registration takes nothing less than 1 minute, or depends on the the response time from the patient or from the client. Let's say 2 minutes, 3 minutes max. So what we need is the first name. So the first name for this patient is Hannah. Let's say the last name is Samuel. Date of birth for Hannah Samuel is 1st of January 1980. Enter. So you see that I typed that in. Another thing I could have done is use the selector to pick whatever dates I want to fill in, but this is a quick way to do it as well. So that's that for date of birth. And phone number, let's say phone number is this hypothetical phone number. If I could enter tags. That means when I pull up the name of this patient, or what's the preferred name for the patient. So let's say Hannah, and I can enter the town. Let's say Hannah lives in Lekki, so this outreach is at Lekki. You can decide to enter any of these other information. I mean, this is quick. This doesn't take time. You can get the residential address or get that later. So I'll click on save. You're about to register a new patient, Hannah. So I'll say okay. Client created successfully. We've done a quick registration for a new patient. So see the record for Anna. So I want to edit Anna's information. I think I entered the wrong date of birth. So let's see, 1980. That works. So Anna is female, married. So let's leave that. Christian. So Anna is a trader. Or let's say trader. Email is anna@tests.com. Residential address is 1 Wally Street. Blood group for Anna is O positive. Genotype for Hannah is AA. No disabilities, so let's say none. Comorbidities, let's say hypertensive, right? Allergies, Anna has is allergic to cold and nuts. Any specific details about Hannah, you need to enter specific only relevant information that you need to enter. And then the next of kin, let's say Eliza Samuel. Phone number would be, let's say, the same. Next of kin email is eliza@tests.com, and Eliza is Anna's husband. So I'll save. Now we've entered the full, or we've updated the patient's record for Anna. So that's how you do a quick registration or a full registration. For a full registration, you enter everything, at the same time. For quick registration, you just enter the relevant or required text fields and you save. Now you might want to manage a patient record. All you need to do is click on the name of the patient on the list of clients. We'll be using Samuel Anna for this demonstration, so I'll click on her profile. Now we have all relevant details for this patient. We can decide to edit, if we choose to. We can decide to delete this patient's record if we feel like it's a wrong patient record or the patient is no longer a participant in this program. Clients. But if we have to schedule appointments, let's say we want people to be able to come in at a certain time to consult with a doctor or get prescriptions or stuff like that, you click on schedule appointments. So let's say we want Anna to, so we need to schedule an appointment for this patient for a later time today. So let's say we're sending this patient to see a doctor in one of the outreach clinics. So once we're setting up your account, we'll set up different outreach clinics as you would specify. You type in the name of the doctor you want the patient to see. That is search for employee. So we want this patient to see Dr. Simpadania. We'll type in the time. So let's say this appointment is for today, 7/2022 at 4 p.m. The appointment type is a new appointment. It can be follow-up, readmission, annual checkup, or just a walk-in thing. So whatever the case may be, you specify. So the appointment status is just been scheduled. Reason for appointment can be left, but you can choose to type in whatever reason that the patient might have given to you. So we'll save. So we just created an appointment for this patient, Hannah. Here you can find the appointment. But regardless of whether we create an appointment or not, once a patient has been registered and the doctor wants to attend to the patient with or without an appointment, they just need to click on the patient's record and click attend to client to attend to this patient. So I'm going to click on attend to client to show you how it takes us to the clinic. So remember, whatever clinic you as a doctor you'll be working from, we would have set up your different clinics once we onboard you. So you choose the particular clinic that you're working from. This would be outpatient clinic. So this way you can easily go and attend to a patient from clients. Otherwise, once we've created an appointment, you can decide to, as a doctor or a nurse, log on to Healthstack, go to the clinic module, choose the clinic you're working from. Remember, we sent this patient to outpatient clinic, so you click on the actual clinic that this appointment was registered under, which is outpatient. You click on that, you find a list of all appointments, you know, for today. So we have, oh, I think I saved this twice. The patient for today for 5 p.m. I will need to edit this, so let me delete one of these appointment records. So we'll be working with this appointment. I think I wanted to set this for 1600, so I've changed the time. Once I've clicked on an appointment like this, all you need to do is click on attend to client to go to attend to client page. So this is where you attend to a patient. For this program, you can search for documentations that you've created for this particular patient by typing in the name of the document. You can start or join a teleconsultation with a patient. You know, you can send out radiology requests. You can send out lab requests. You can send out prescription requests, and you can document your patient encounter. So once you are seeing a patient as a doctor, you've done your physical examinations, proddings and questionings and all of that, you want to document, you know, that encounter. You click on new document, and doctor's note or clinical note, whatever it is. So let's do doctor's note. You write in the title of the note. Doctors know whatever, like the title, the kind of title they give their notes. So let's say you can, let me just use the name of the patient as my title. So you can document encounter. Let's say chest, she has chest pain. You can document your clinical findings, whatever it is that you would have found. Examination. So you can save this document as draft if you want to. You can save this document as draft if you want to continue documenting, you know, as you go. So let's save as draft. Once we've saved as draft, the patient's folder would have, you know, would show you that now you have a new document here. So this is a document we've saved as draft. Once you click on the document, you'll find that the form is, you know, active again for you to complete your documentation. Investigations, and you can save as final because you are done with that documentation. If you have to do any more documentations, that means you have to open a new form, doctor's form. So I'll click OK. Now we're done with that document. We've updated successfully. Once you click on the document, you will find, you know, a summary like this. You can delete a document. You can decide to print out a document or whatever file you find in the patient's record. All you need to do, have your printer set up, and, you know, click print to, you know, print. Also, you can document patient's vital signs. So let's say this patient walked in and they have a temperature of 36, pulse of all, and 90 kg. So I'll save this as final. I think I'm done with this document. I'll click on save. We're about to save a document, vital signs. Okay, created successfully. Now we've created vital signs successfully. You see how once we create a document or whatever it is we do, we keep getting, you know, they are dropping down here. So this is the patient, this is like the patient's folder where you can find every documentation, every transaction that concerns this patient. So if I click on vital signs, you will find a summary of what we just typed, we just entered. Actually calculates your patient's BMI, so this helps to make some decisions as a medical practitioner. So that's that for documentation. How about when we want to send out prescriptions for patients we have seen? So let's say this patient we have just seen, we feel like they should be on some medication whilst we are waiting for investigation. So we'll send out, we'll add so this is where you find a list of all prescriptions that we have sent out for this particular patient alone. You can search out a medication from the list of prescriptions. You can use the create prescription form to add new prescriptions. So let's say this patient actually complained of pain, so we might want to, let me say I want to prescribe morphine injection 2 times today. So you see the name of the medication, and you see here we have an instruction or note for how it should be given to the patient. So you enter 2 times today. You can change how you want this prescription to go, but for this program it's going to be an in-house thing. Of course, if you have to work with a third-party agency, they have to be on Healthstack for you to be able to send out a third-party request for prescription, lab or radiology imaging, clinical imaging for that particular patient. So you click on the add button. So here we have medication, morphine injection 2 times today. So you can add as many prescriptions, medications for prescription for this patient. Once you're done, oh yeah, we have tab paracetamol. So let's say 500 mg paracetamol. Instruction for whatever for dispense you add. So you can add as many medications as possible. I'm not just going to delete, so I'll click on create to send out this prescription. So what I'm doing now is create a prescription now. So you notice how you will see how the prescription we just sent out will be added to this patient's history. You can decide to print out the prescription as well, or you can delete the prescription. Now we're going to go over to pharmacy to show you how to dispense products. So I'll click on pharmacy. I'll go to GOPD pharmacy, and first of all we need to enter products into our inventory. So let's say we are entering a product as initialization because we might not have all the necessary information for that product. So today there's no invoice number, let's say 50,000 naira, and we're adding aspirin cardio. We're adding about 100 tablets of aspirin cardio, and it's 500 naira per tablet. That's the unit cost. We'll create. You can add as many products as possible. Create. You're about to save this entry. Okay. So what we've done is we've added a product to products to inventory. So let's go to inventory. I just added these products, aspirin cardio, morphine and paracetamol, so we can find the quantity. We have 100 tablets of aspirin cardio, we have morphine 50 injections, and then we have 500 tablets of paracetamol, 500 mg. This is the stock value. This is the cost price. For this program we might not need to add any selling price, but if you want to add selling price, you click on the product you want to manage or modify. You can set a new selling price. You can set the batch information for this particular medication. Let's say the expiry date for this medication is January 2025. Sorry, so this is January 2025, and all of the 100 tablets we have will expire in January 2025. You add and you save, so that when this product is nearing its expiry date, you can get an alert to make you know that, okay, you need to do away with those products or get new ones. You can also set a reorder level. Maybe for this call, we'll be seeing a lot of patients, and you want the system to alert you when you are nearing a certain number of a certain quantity of your product. So let's say once we get where we have 10 tablets of aspirin cardio and below, the system should give us a signal that we need to reorder. So I'm going to save this reorder level, and that works, so that's fine. So let's go and dispense this product. Like I said earlier, we need to, once they send out a prescription from clinic, you need to you will find that prescription in the bill prescription sent page in the pharmacy module. So this is the patient we sent out a prescription for, called Anna Samuel. These are the prescriptions that were sent. So we have to build these prescriptions for us to be able to dispense them. So let's say a prescription was sent for paracetamol 500 mg. I'll click on that. There's no price here, so that's why we see that like that. So we're prescribing 10 for this patient. You can adjust the price if you want to. You add. Okay, let me click done. Let me bill morphine injection differently. So let's say we're billing morphine injection. So we have 50 injections at 0 naira. I already done that. So we're giving just 2 morphine injections to this patient. You can write out an instruction. You can see the instruction for how we should be given out. So it's 2 times today. So we add this and click done. So we're done. We've actually billed these prescriptions that were sent. Now we can go back to pharmacy to dispense this prescription. Click POS to dispense this product. Here you will find all product exits from inventory. This is the detail of product exits. To create a new dispense transaction, you need to click on new to get a product exit form. All you need to do is click on, you just set as sale or dispense, whichever. You type in the name of the patient. So let's say this patient's name, let's use Anna Samuel. And so we want to dispense paracetamol for Anna again. We want to dispense 5 more tablets for Anna. You add and you click on sell. So this way you don't have to process anything for Anna. So once a prescription has been sent, you can just view the prescription here, pending prescriptions, and then go to POS to dispense or to exit that prescription from inventory. So basically, yeah, this is how you use Healthstack to register a patient, attend to patient, and send out prescription requests and dispense prescriptions. Thank you.